Well, Target joins the list of major big box stores that is either reducing or eliminating the health insurance available to part-time employees. Target's also, I guess, laying off, or another word for terminating, some 400 middle management people in the home office and the regional offices and so forth. And they're tightening their belt and getting on with profitability. Well, what's happening is, as these part-time employees complained, they said, look, go apply for a subsidy through the Affordable Health Care Act, and the odds are you'll get a subsidy and you'll be able to buy insurance through that system. And I'm sorry, there's nothing we can do for you. Well, what you're going to find is this is happening more and more and more as the deadline comes up in just a couple of weeks. You're going to find that businesses are looking at the penalties, they're looking at how much insurance costs them, and the health insurance is really what killed America financially. The health insurance for working employees, the health insurance for retired people. Used to be retired people died at 65. Well, now they're dying in their 70s, maybe even their 80s, and so they're on insurance payments that the company or their insurance retirement systems or the government's paying for. And, of course, this is a huge load. It was unexpected, and Medicare, Medicaid, and even private insurance never expected all this to happen. Well, the reason why insurance keeps going up and up and up is because the medical system knows that the employees, the ones that are working employees, members of unions, will strike and bring the company to its knees and say, look, we have to have better medical benefits because the medical system is raising prices. We have 3 sick members in our family, and we need to have more insurance, and we'll just stay out and block your income flow until you give us higher medical benefits. So it's always been the medical benefits which is the cause of the manufacturing assembly companies moving out of the country, not greedy CEOs. It's actually the high cost of medical benefits. So here's what I propose. I propose that everybody accept catastrophic insurance with a $5,000 or $10,000 deductible. This will be for a family of 5. You're looking at like anywhere from $80 to $120 a month. And if you get on at the same time, like one Healthy Start pack per individual in your family, appropriate for body weight, you're going to find that you don't get sick as often. You don't get colds. You don't get the flu. You reduce your risk of arthritis and fibromyalgia. You get on a gluten-free diet, you absorb more nutrients, and you reduce your risk of Alzheimer's disease, macular degeneration, high blood pressure, heart attacks. But all these things are caused by nutritional deficiencies. So if everybody were like me medically, I'm going to be 75 here in a couple of months. I have not been to a doctor with me being the patient for 67 years. I've never been on a prescription drug. There is one piece of paper in my health records, and that's my birth certificate. If everybody in America were like me medically, the medical system would be real humble. In fact, 2/3 of them would pack up, move out of the country because they couldn't make a living as a doctor here. Now, you go visit your doctor once every 75 years. That's probably too much. I'd like to see people visit a doctor once every 120 years from the time you're born. And this is possible, but you're going to have to be obsessive. You're going to have to take all 90 essential nutrients appropriate for body weight. You're going to have to avoid all the bad stuff. You're going to have to eat right. You're going to have to supplement right. And you're going to have to use our Rebound sports drink with 100 nutrients in it when you exercise or you work in a job or trade in which you sweat. Because sweat is not water. Sweat is a soup that contains all the nutrients floating around your blood. If you just drink water, you're not getting any nutrients into you when you sweat. If you drink some of these sports drinks or energy drinks that have 2 to 6, you're in trouble. You're going to get injuries. You're going to break down your back, your disc, your joints, your cartilage, your ligaments and tendons. But if you take the 90 essential nutrients appropriate for your body weight, you throw in a Rebound with 100 nutrients in it to replace what you're sweating out. Instead of just water or the other sports drinks that have 2 to 6 nutrients, we have 100 nutrients. So if you really consciously take care of yourself by at least doing what you do for your dog for yourself, right? You're going to add many healthful years to yourself and your family. You're going to reduce your health care costs. You're going to reduce your health insurance use. I don't want to say needs because you really don't need health insurance. Effectively, health insurance in America has been the worst possible thing for American health because the medical system went after the insurance. You come in and you complain about your back. The doctor runs into his back office. He looks at the insurance codes and he sees, what's the most expensive thing I can do? What's the most money I can make from insurance for somebody complaining about their back? And then that's what they do. It's not like the old-time doctor who's a member of your family, and he'd come out in his horse and buggy, and he'd start the fire in the morning and get coffee going and bring wood in for the fire, and then see the family, and he knew everybody from the time they were born. Not that kind of doctor anymore. They know what they're going to give you before they even see the patient. They're looking at the lab test. They already made up their mind. They don't have a lot of time. They need to see 50 people a day to be able to cut to the chase and make all their money to pay their bills, their overhead. So they'll walk into the office and say, look, any complaints that I don't know about? No? Okay, well, here's your prescription. See you next time. Bye. And he runs on to the next thing, and the patient's kind of left. What happened there? Did I really see the doctor? Was it worth an $80 visit? No. Well, contact your Youngevity associate, ask for the trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, and learn how to take care of yourself. 900 different diseases using vitamins, minerals, trace minerals, rare earths, amino acids, fatty acids, herbs, and aromatherapy oils. The trilogy of books. We'll be back after these messages. Okay, Doug, what pearls of wisdom do you have for us today?
I've got a story I got from Fox News here that's headlined, Routine Tonsillectomies Not So Routine. And what they're talking about is, of course, there's 500,000 tonsillectomies done every year in this country, and it's the second most common pediatric surgery. But they're now asking, but just how routine are these procedures? Because a new study out and published in the journal Pediatrics has found that the care can actually vary depending on which hospital you go to. According to the lead author here, Dr. Sanjay Mahant, says we were surprised to the degree of variation between hospitals in the use of medications and revisits to hospitals after the surgery for complications. The study itself, researchers analyzed data from the Pediatric Health Information System that looked at nearly 140,000 low-risk kids, and these all underwent tonsillectomies between 2004 and 2010 at 36 different children's hospitals across the country. And according to the guidelines from the American Academy of Otolaryngology, the head and neck surgery, doctors recommend that you use a drug called dexamethasone the day of the tonsillectomy. It's used to reduce nausea and pain after surgery. Guidelines also recommend not using antibiotics because previous studies had shown that antibiotics do nothing to prevent bleeding, pain, or infection after the tonsillectomy. They say in addition to looking at whether hospital staff follow these guidelines, Mahant and his team also calculated the number of patients who returned to the hospital in 30 days after surgery for bleeding, vomiting, dehydration, pain, infection, and or respiratory problems. And this kind of was what's highlighted this was the fact that this child in Oakland, California, Jahai McMath, who underwent a routine tonsillectomy and is now laying in a care facility brain dead, and all from complications of this routine surgery. And they say in the study they found that close to 70% of the patients did get this drug to reduce the nausea and the pain, but however, a third also got antibiotics, even though guidelines recommend not using antibiotics. They say a total of almost 11,000 kids, about 7.8%, nearly 8%, actually had to return to the hospital after being discharged for bleeding, vomiting, or dehydration. And those that returned for vomiting tended to come within the next day or two, and those that returned for bleeding was most likely within the first 6 to 7 days. They say older children were more likely to suffer from bleeding problems, while younger children were more likely to experience nausea. I just find it interesting that, we've been told, even when I was a kid, tonsillectomies were this, quote, routine surgery. I was fortunate. My doctor as a kid was actually a surgeon, and believe it or not, Doc, he did not take my tonsils out.
Well, tonsillectomy is kind of like, what should I say, they don't know what else to do, they take your tonsils out. And it's one of those operations, and 99% of the time it really does not need to be done. You get people on a gluten-free diet, you have them gargle with colloidal silver, in case there is a little low-grade infection in there. Again, you get them on a gluten-free diet, you get them on a dairy-free diet, get them on the 90 essential of nutrients, and 99% of those tonsils will calm down. Even if they are enlarged, they'll just calm down. It's not a big problem. And tonsillectomy should not be done 99.9% of the time. It's just awful. I mean, I know of so many people who die of routine surgical procedures. That's because surgeons get weary. Their technique gets a little bit sloppy because they're tired. Maybe because they were up in an emergency room the night before. You know, they weren't goofing off and drinking at a bar, but they were up until 2 o'clock in the morning because they were in the emergency room. Then they come in for the scheduled surgery, and they're sloppy. And so I'm not really interested in having kids get tonsillectomy. It's absolutely insane. It's very primitive. It's less like you get the flu and the doctor wants to do bloodletting on you. He's going to take a pint of blood so he can get all the humors in balance. Now, that goes back a couple thousand years. Why keep doing that stuff? We'll be back after these messages. Okay, Doug, let's go to callers.
Let's head to Canada. And Dave, you're on with Dr. Wallach.
Oh, Dave, you're on the air.
Thank you, Dr. Wallach, and bless you for all the good stuff that you do. I've got a hero list.
How can I help you?
Hero list. I'm doing this third party, so it's a 5-year-old girl who is 3.5 feet tall, and she weighs about 50 pounds, and she has late infantile Batten disease.
Okay, you have to tell me what Batten disease is. It sounds something very British.
Well, it's I guess it's maybe akin to muscular dystrophy, where the body starts to atrophy and that kind of stuff.
Sure. Okay, muscular dystrophy. Well, without knowing much more about her, what I would do is have her get on a gluten-free diet. Absolutely no gluten, so we can maximize absorption of nutrients. That means no wheat, barley, rye, or oats, no fried foods, no processed meats with nitrates and nitrites, no oils, no margarines, mayonnaise, salad dressings, cooking oils, no gluten again, no wheat, barley, rye, and oats. Just get rid of all the inflammatory stuff and anything that's going to inhibit the efficiency of absorption. And then, at 50 pounds, I'd get her one healthy bone and joint pack, and that will last her 2 months, because that's for 100 pounds for a month. So at 50 pounds, one healthy bone and joint pack will last her for 2 months. You're going to give her half a dose of everything at breakfast, lunch, and dinner. So what that'll do is give her 2 of the Ultimate Selenium each day. It's going to give her a tablespoon or a half ounce of the OsteoFX Plus twice a day. It'll give her 1 scoop of the Beyond Tangerine 2.0 NutriCrystals at breakfast and 1 scoop at dinner. The EFA Pluses, she can have 3 of those a day, 1 at breakfast, 1 at lunch, 1 at dinner, or 1 at breakfast and 2 at dinner. And then I would also give her 1 of the D-Stress capsules, capital D, like David, dash stress, and then 1 at breakfast, 1 at dinner. That's for the metabolism of the muscles and so forth. And again, between the diet and the supplement program, if this is anything akin to muscular dystrophy, fibromyalgia, lupus, this will, in fact, support and promote maintenance and repair. And so you can find out a little more information about probably the doctors think it's autoimmune or genetic, but if it's akin to muscular dystrophy, it's really very simple to deal with. So do give us a call every couple of weeks. Let us know how this little gal is doing. And, you have to look that up for me and tell me a little more information because I've never heard the term. Probably named after Dr. Batten. Okay, we'll be back after these messages.
Let's head to Indiana. And Joyce, you're on with Dr. Wallach.
Oh, Joyce, you're on the air.
Hi, Dr. Wallach.
Hi.
Thank you for taking my call. Yeah, I'll get to the point. I know you have a lot of calls. I've been dealing with some physical things, and they're diagnosing me with these autoimmune diseases like Sjogren's syndrome.
Okay.
One, and then I was tested for lupus, and my scores were debatable or something with that one. And the rheumatologist said, well, I think it might be skin lupus, but I have rosacea, so they're confusing all that, so I don't really know. But that's why I've been trying to eat gluten-free.
Let me ask you a couple of questions here. I already know, and I believe Shar already knows what's going on here, but did you have asthma as a kid?
No, not really. I do more as an adult. I had bronchitis. I had strep throats a lot as a kid. I had rheumatic fever.
Well, that's useful. And then do you have children?
Yes, I have 5.
Okay. Do any of them have skin problems? Any eczema, dermatitis, psoriasis, or rosacea themselves?
Eczema.
Yeah.
All had that. Yeah.
Okay. And how much do you weigh?
I think I weigh 140.
All right. Any other issues? Diabetes, heart disease, high blood pressure?
Oh, I have AFib. I developed that, and I've always had a fast heartbeat, but I guess I likened it to the rheumatic fever. But now I was in the hospital several times with AFib, and
Let's stop there for a minute. Okay, Shar, what do you think is going on here?
She's got a gluten problem, but she also needs glucogel for the AFib, so she needs the Healthy Bone and Joint Pack because the glucogel will take the AFib.
Is AFib a heart problem?
She's not got a heart problem. She's got a irregular heartbeat because the vertebrae are squeezing the nerve going through her back, and she needs to get the glucogel to rebuild the cartilage between the vertebrae so that nerve won't be squeezed.
Okay, very, very good. You get an A+, Shar. Very good. When you have AFib, Joyce, you do not have a heart problem. And, of course, doctors like to run up a $500,000 bill for cardiac procedures. They'll install pacemakers. They'll install defibrillators. They will do ablation where they kill portions of your heart muscle. Quote, hoping to find the place in the heart that's running amok here and making your heart go fast, unquote. And then when that doesn't work, they'll do a retro version where they electrocute you to death. They sing a little ditty for 2 minutes and then an attempt to wake you back up, which they do 95% of the time because it's under controlled circumstances. 5% of the time you die. And then when that doesn't work, when those two things won't work, they'll actually put you on the heart transplant list and run up a $500,000 bill for cardiac procedures when it's a back problem, as Shar said. So what we'd like you to do at 140 pounds, you're kind of at that cusp, but you have AFib, you have rosacea. You really need to get on a gluten-free diet. All your children need to be gluten-free. Your husband or man in the house, grandma, mother-in-law, dog, cat, fish, bird, every being in the house needs to be gluten-free because of cross-contamination, food preparation services, couch, bed, laundry. Nobody in the household can be eating or even thinking about gluten. Okay, then the rosacea goes away, the asthma goes away, the dermatitis goes away, all the skin problem goes away, and as Shar pointed out, I'm going to take 15 glucogel a day, which will be accomplished by the 2 large bottles of glucogel and the 2 healthy bone and joint packs. And guess what? You'll make those vertebrae happier. You'll get the disc thicker, and the AFib stops. We'll be back after these messages.
Well, let's head to Alabama. And Anthony, you're on with Dr. Wallach.
Well, Anthony, you're on the air.
Hey, Doc, I've got two gentlemen. One has high blood pressure, flutters in the heart, loses train of thought, anxiety attacks, and 5'9", 185 pounds to 190. And the second gentleman, well, I'll take the second gentleman when you're finished.
Sure. Okay. Well, high blood pressure, anxiety attack, loses train of thought. Okay. And do you know anything more about him? Does he have any respiratory problems, any skin problems, anything like that? Hello? Okay. Well, now we'll go with what we got here. High blood pressure, loses train of thought. That can all be sort of related. Be having some blood sugar problems, which can also cause anxiety. Could have obstructive artery disease in the brain, which can cause sort of like an avascular dementia. And certainly obstructed arteries in the kidney can result in high blood pressure. So what I would do is I'd give this fella 2 of the healthy heart and brain packs per month, 1 full dose for everything at breakfast, 1 full dose for everything at dinner time. I would also throw in the Ultimate Daily tablets. That would be 3 twice a day. That's 1 bottle a month to support and promote healthy blood flow through obstructed arteries and support and promote healthy blood pressure. I would also give 3 of our sweeties twice a day, just in case it is anxiety and lose train of thought is a hypoglycemia or reactive hypoglycemia problem. Okay, Anthony, are you there for the second question?
Yes, sir. Gentleman, osteoarthritic degenerative hip disease, and while he was in the military and out of the military, and he was talking about operation soon, I told him that's a no-go. Go ahead.
Okay. Yeah, we need to find out some things, but 99% of the time, surgery for hip problems is a no-go. Surgery for back problems is a no-go. In fact, the orthopedic surgeons from the School of Medicine at Harvard came out in 2002 and said joint surgery for arthritis and joint problems is worthless. And then 4 years later, in 2006, they came out and said, oops, back surgery for back pain, sciatica, peripheral neuropathies, bulging disc, ruptured disc, all that kind of stuff is useless. And, of course, we like to use the Healthy Bone and Joint Pack. So the guy, the second one, what does he weigh, you think? Well, Go ahead. What does he weigh?
250.
250. Okay. Well, he's right at that cusp. And I would, if they're talking about surgery, I'd have him take 3 of the Healthy Bone and Joint packs per month. That'd be 1 ounce of the OsteoFX Plus at breakfast, lunch, and dinner. 2 scoops of the Beyond Tangerine NutriCrystals at breakfast, lunch, and dinner. 3 of the EFA Pluses at breakfast, lunch, and dinner. And then, of course, that will allow him to have 20 glucogel a day, 5 at breakfast, 5 at lunch, 5 at dinner, and 5 at bedtime. And that will support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, and bone itself. Call me every 2 weeks on these fellows, Anthony. Okay, Doug, let's go to callers.
Let's head to Minnesota. And Jeff, you're on with Dr. Wallach.
So, Jeff, you're on the air.
Yes. Back in 2009, I went to the hospital with a strep B infection and a blood sugar of 600. When I came to, my vision was blurry. 3 years later, my kidneys went out, and I'm on dialysis for the last 15 months. I take some Beyond Tangy Tangerine, and the last 10 days I added Ultimate Classic, 2 tablespoons, and 2 sweeties to it, and they cut my time a half an hour on the machine. So, but I think I've heard you, I don't know what to do next.
Okay, now, Shar?
Yeah.
Okay, what would you add for a kidney failure dialysis other than the, it sounds to me like Jeff is on the Healthy Start Pack. What would you add to that for the blood sugar problems specifically and for the dialysis?
He needs the Ultimate Daily for the dialysis, and he needs, for the blood sugar, he needs the sweeties.
Perfect. A+. Yeah, and so what I would do, Jeff, 250 pounds, I want you to have 3 bottles a month of the sweeties. As Shar says, it'll allow you to have 3 at breakfast, 3 at lunch, 3 at dinner, 9 a day of the sweeties. If you're on medication, you want to be sure that you're taking your fasting blood sugar in the morning before you medicate yourself, whether it's pills or insulin. And then for the dialysis, you're going to find that slowly you're also going to be weaned off of your dialysis because there's usually nothing wrong with your kidneys when you have kidney failure. It's kind of an oxymoron or one of those paradoxes. There's nothing wrong with your kidneys when you have kidney failure. What happens is you get an obstruction of the arteries, which can cause high blood pressure, but also it prevents the dirty blood from getting into the filtering units. So this is what Shar's talking about, the Ultimate Daily tablets. And I would go ahead and have 3 of the Ultimate Daily tablets twice a day. That's 1 bottle a month. And then call us every couple of weeks. Let us know what your blood pressure is. Let us know what your weight is. Let us know how your kidneys are going and what they're saying at the dialysis laboratory. And let us know what your blood sugar is, okay? All right. Doug, let's go to callers.
Let's head to Texas. And Patsy, you're on with Dr. Wallach.
So, Patsy, you're on the air.
Hi, I'm calling about macular degeneration. That's what I have.
Okay. And how much do you weigh?
About 140.
Okay. And how old are you?
Oh, you're not supposed to ask a woman her age?
Yeah.
Okay, I'm 72.
Okay, well, you're just a child. Shar is 70, so you and Shar are about the same age. And so I can tell you, Shar acts like she's 12. And so age, chronological age doesn't mean anything compared to your biological age. And so don't let that frustrate you. You know, if you're taking your 90 essential nutrients. And what would you do to start out to help this young lady here, Shar? She's 72 years old, 140 pounds, got macular degeneration. What would you do for her?
Well, she needs, for the macular degeneration, she needs the selenium to get that. There are just age spots in the eye. That's all macular degeneration is. So she needs the selenium to clean that out. And at 140 pounds, she probably could get by with just a healthy. I would give her the Healthy Bone and Joint Pack, though, because at that age, we probably all got arthritis at that age.
Yeah, a little bit of osteoporosis, a little bit of arthritis. So you're exactly right. Patsy, what I want you to do is take 1 Healthy Bone and Joint Pack per month. I'd get an extra bottle of glucogel, so you can take 15 of those a day, 5 at breakfast, lunch, and dinner, and then divide everything else in half and take half a dose of each of the 3 products at breakfast and dinner of the Healthy Bone and Joint Pack. I'd get you 2 bottles of the selenium, as Shar suggests, so you can take 3 twice a day, 3 at breakfast, 3 at dinner, and that's going to support and promote your immune system and the ability to help your phagocytes and those kind of things are called. There's cells that gobble up dirty stuff. They're going to get the pigment out of your eye that's the same, as Shar says again, as the age spots and liver spots on your skin. If you have any age spots and liver spots on your skin, you can use that kind of as a monitor, because as they're getting lighter, the pigment in your eyes is getting lighter, and you're able to see. We see people actually with macular degeneration, even if they've been declared legally blind for 6, 8, 10 years, they can get a complete reversal. Often in 90 days, 3 to 6 months. We actually have a CD called Seeing is Believing you should get too, and see what to do about that. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity and 90 for Life Crusade. And Doug, let's go to callers.
Let's head to Arkansas. And Harvey, you're on with Dr. Wallach.
Well, Harvey, you're on the air.
Hey, Dr. Wallach.
Yes, sir. How can we help you?
I just want to ask a question in general about an unvaccinated family during the flu season, if you got any information in particular.
Yep. Well, unvaccinated families during flu season is a pretty smart idea, because just about everybody who gets vaccinations gets sick with the flu, and that's because when you get the flu vaccine, it knocks your immune system down for about 90 days. If anybody wants to get the flu shot, they really should get it in May. And they get it in May, then by July, their immune system's back up and will partially defend them. They'll get some defense out of it, because it takes about 90 days for your immune system to recover from reacting to the vaccination. It's insane to do flu vaccination right at the beginning of the flu season. So I never like it at all. I've never had a flu shot in my whole life. And none of my family does. But we do take extra precautions. We have the PureWorks. In the PureWorks, we have the spray, the foam, we have the lotion, we have the liquid. And the unique thing about the PureWorks from Youngevity is that it does not have any alcohol in it, so it doesn't dry or crack your skin. And when you use the alcohol-based hand sanitizers, kind of like Purell and the other ones that are alcohol-based, they only have killing power when they're wet. Everybody's waving their hands around as quickly as possible to dry their hands, because they don't like the smell and all this, that, and the other. And so they only get about 10 to 30 seconds worth of killing power. Well, the nice thing about the PureWorks, whether it's the spray, the foam, the soap, the liquid soap, or the lotion, is there's no alcohol in it, so you don't get a drying, cracking effect in the skin. You actually get a soothing effect from the ingredients in the PureWorks. Not only that, but the killing effect of viruses, bacteria, fungus, and yeast goes on for about 4 to 6 hours. It's very, very exciting stuff. I use it all the time. And for flying, it's great because the foam only has 2.5 ounces, so it's below the 3 ounces, so I can take the foam with me on my carry-on. And that way, anything that I touch, I use the foam. Now, I also carry the spray with me in my checked-in bags, because I like to spray everything, like the telephone, the fixtures in the bathroom, the TV remote. Anything that I'm going to touch in that hotel room, I use the spray, and that kills anything that was left behind. Things that are legendary in hotels. And maybe even when you visit somebody else's house and they have a lot of little kids and they don't wash their hands after they go potty, and all of a sudden there's poop everywhere. And so it's really imperative that you use the PureWorks foam, spray, lotion, and also the liquid soap. So that'll help you out quite a bit. Doesn't hurt also to take the Killer Biotic. I take 3 of those twice a day as kind of a preventative. It's 8 herbs. It's a blend of 8 herbs that supports your immune system. 2 of the 8 herbs also have antimicrobial properties, will kill bacteria, fungus, yeast, and viruses. Okay, how much time we got left here, Doug?
We got just a little over 60 seconds here.
60 seconds. Okay, Shar.
Yes.
What advice would you give for people to protect themselves against the flu?
I would just say the same thing. Do not get a flu shot. I don't have them. I don't get them. PureWorks is the greatest thing. Take the Mighty 90 every day and keep your immune system up, and you don't have to worry about it. Even if you start to get it, it'll go away right away.
Absolutely. And, of course, if you get the flu, you want to use the Rebound as a sports drink to replace all the fluids. Let's say you're throwing up and you have diarrhea and all the stuff that goes along with flu, and you get the sweats because you got a fever. You want to drink that Rebound. If you don't like the carbonation in the can, we have the sticks and we have the canisters that don't have carbonation in them. And you get sick with the flu or the cold or anything, you're in home and you can't leave the house because you're ill, you want to use the Rebound to replace everything you're sweating out or pooping out or throwing up out, okay? And I love that Rebound. It'll replace everything you're sweating out. or you lose through diarrhea or vomiting. So great stuff, and take care of yourself. It's amazing what you can do. You want to avoid doctors at all costs, and of course, if you do have to go to a doctor, go to emergency room, take PureWorks with it, and as they walk into the room, spray them with the PureWorks. Don't let them touch it without you spraying them with PureWorks. Well, thank you, Shar. Super job as usual. Thank you so much, Doug and Billy. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.